All right, welcome to tonight's health and wellness class, and it is December 20th, 2022. We got 5 more days to Christmas. And welcome to the Spinal Health and Wellness class. And my name is Dr. Jay Hartley. I'm a chiropractor in St. Augustine, Florida. I graduated from Palmer College of Chiropractic in 1992, believe it or not, so 30 years in practice. And then in 1995, I became a chiropractic urologist. That's a specialty in chiropractic where you have 400 hours, you sit a board, very stringent board. 80% of the people failed the board exam when I took it. I was one of the lucky ones. And then in 1996, I opened up Hartley Chiropractic in St. Augustine, Florida. In 2011, I became a fellow of the Palmer Academy of Chiropractic. And then in 2015, I started working with Scoliosis, and I got certified by Clear, which is headquartered in Minnesota. I had a personal experience with my daughter getting helped where she had a progressive scoliosis, and then I myself went through it. I had scoliosis growing up, and at that time, the only treatment available was surgery, and so we didn't do the surgery, but later I got help as an adult. And then I became intensive care certified in 2016. That means patients are able to come with larger curves, meaning 30 degrees and higher, from other states and countries, and they'll come stay here for 2 weeks. They'll do a 2-hour session in the morning, 2-hour session in the afternoon. They're here for 2 weeks, and we do the correction, teach them home exercises, and then they go home, keep up with the exercises, and come back 3 to 6 months later for a follow-up. And then in 2017, we became a Scoliosis brace provider, and we're going to talk about that in a little bit. But Scoliosis brace is an overcorrective or supercorrective brace. Normal medical bracing, just kind of squeezing your spine, hoping that it doesn't get worse. Or this is an overcorrective brace. It actually puts your spine in the mirror image of the bad position that it's in. So that was a little bit about myself. Now we're going to talk about the United States of America. Where do you think the U.S. is ranked today in overall health? There's about 200 countries in the world. We'd like to be number 1. Very positive. Any other guess? No? 37. We should be a lot higher than that, right? These are some of the reasons that we don't rank very highly. What do you think we ranked in the world in infant mortality? I threw you off with the 37 now. No more guesses. 52nd. So some people say, how can that be 52nd? Well, birth is already something that's perfect. And if you try to correct something that's perfect, usually it's going to be less perfect. So there's third world countries that have very little medical care that have a higher survivability rate than we do in the United States. Over 1 million mothers, daughters, fathers, and sons will die from heart disease and cancer this year. Would you agree we need to make some major changes in the way we approach our health? Do you think we could be healthier? Yes. So there's 5 attitudes that prevent us from being healthy. 1, it's out of my control. 2, it's normal to get sick. 3, disease makes us sick. 4, only see the doctor when you're sick. 5, it's expensive to be healthy. So we're going to go through these 5 attitudes that prevent us from being healthy. First one is health is out of my control. Genetics are responsible for less than 1% of all disease. So we can't blame it on our parents. We have to take some personal responsibility. Health is simply the result of having healthy habits. What you do every day determines whether you're healthy or not. Are drugs the answer to humanity's problems? Well, in the United States, we consume more drugs than any country in the world, yet we're ranked 37th. So we know drugs aren't the answer, because if it was, we'd be the healthiest. As a matter of fact, all drugs cause side effects. So if you take a drug for one condition and then you start taking drugs for the side effects, then those cause side effects, and you really can end up on a lot of medication. And the average senior citizen is on 6 to 10 medications a day. And so that can create a lot of things going wrong in people's bodies. Prevention versus crisis. If you Buy a car, drive it as hard as you can, never change the oil, never do any maintenance. Eventually that car is going to blow up. If it blows up right next to a new car dealership, you can walk out of the blown up car and just get a new one and drive off, right? But you can't do that with your body, right? You got to take care of it. You have to practice prevention. What are symptoms? Symptoms are merely the result of the body being out of balance and alerting you to a problem within. Symptoms serve as a warning that something needs to be explored and changed in one's life. Illness is a message. Dennis Jaffe, PhD. So if a fire alarm goes off, you're not going to cut the wire to the fire alarm. You're going to find out why it's going off, right? Get to the cause of the problem. Many times we take prescription medication to cover up the pain, but then we're not getting to the cause of the problem. Second attitude, is it normal to get sick? It's normal to be healthy. We're going to talk about that a little bit more and about symptoms. Is it the seed or the soil? Well, the seed is like your genetic potential. The soil is your environment and the nurturing. There's plenty of people with great genetic potential that never amount to anything, but there's also a lot of people that have lesser than perfect genetics, but because of their environment, their hard work, and their persistence, they turn out to be great. Third attitude is disease makes us sick. So we see the word dis-ease with the hyphen there. Hippocrates talked about health as ease. Loss of health is when we move away from that. And that dis-ease is lack of harmony inside the body. So we spend billions of dollars a year studying disease and virtually nothing on health. So we're focused on disease. We're always trying to figure out how are things going wrong, but many times we miss how it's going right, and that's what we should be focused on. If we just looked at healthy people and repeated what they did, we'd be in a better place. In 1972, President Nixon declared a war on cancer, and every year since then, the cancer rate's gone up. So we should, declare a victory with health, or word it differently, something like that. How life begins. 2 weeks after fertilization, the primitive streak is created. This will become the central nervous system, the master system, controlling every other cell and tissue in the human body. So we have this spinal cord that's created. Everything grows off of that. In utero, we're in this fetal curve, and we're in amniotic fluid. And that's so if the mother falls or is hit by something, there's like a cushion, and it protects her, and it protects the spinal cord of the baby. With scoliosis, it's very important to preserve the fetal curve, especially in this area right here. And there's a French OBGYN, he wrote a book called Birth Without Violence, and he said he saw how babies were born, sometimes pulled out with forceps, and then there's a bright room. They lay the baby on its back after it's been in this fetal position for 9 months. They shine a light in its eyes, drop some silver nitrate drops in the eyeballs, and they say, welcome to the world, right? It's a little bit of a shock, but it can cause you to lose this curve. And with scoliosis patients, sometimes they actually have a forward curve here. So we want to preserve that backward curve. Now, 3 to 6 months, we do tummy time, and that's where we're developing that cervical curve. In babies, if you just put them on their stomach, they automatically do it. It's an innate reflex, and it develops that cervical curve. So if you don't have a good cervical curve, either you didn't develop it there, or something happened to you, some kind of trauma. And then at 6 to 12 months, when you crawl, you develop the lumbar curve. And so then you end up with these 3 curves, and they allow your spine to work like a spring, and they keep it strong and flexible. Defense against germs. There's no magic bullet, instant gratification, or miracle cure against viruses or bacteria. There's only increased internal resistance from hard work, nutrition, exercise, rest, positive mental attitude, and chiropractic care. The central nervous system controls the other 5 systems in the human body: glandular, elimination, digestive, musculoskeletal, circulatory, and lymphatic. So the brain is sending the signals down the spinal cord, out the nerves to all the cells and tissues of the body. Gray's Anatomy states the central nervous system controls every cell tissue in the human body. So the signals go from the brain down the spinal cord, out the nerves to all the tissues of the body. Your body's 98% new every year. So these signals are coming out and they're producing new cells. The question is, how good of a cell are they producing? Are they producing the best possible cell that they could? That's called regeneration. When they don't produce healthy cells, that's called degeneration. We want to make sure it's causing regeneration. Guidance physiology states the autonomic nervous system is the major system controlling the mechanism of homeostasis. Homeostasis is your body's ability to adapt to the environment. So if you have a fever, is that good or bad?
Well, it's good because your body's fighting off the environment.
Right, it's good. It means your body's mechanism is working. You got the bacteria in your system, then the system raised the temperature to kill the bacteria. Very good. So that's a positive. That's what homeostasis is, and that's what health is. Subluxation, we see the word silent degeneration there because only 10% of the nerves have to do with pain. 90% control and coordinate all your bodily functions. So you can have things get out of alignment for many years without ever feeling anything, especially when you're young and in middle age. Your body is like a garden with proper raw materials and no interference. You will regenerate and be healthy. Healing takes time. So the spinal cord is like the hose. The nerves are like the sprinkler. The roses are like the organs. If we have a rock on the hose, then we're not going to get the water out to the roses or the nerve flow to the organs, and then those roses or organs are going to die. If we take the rock off the hose, then it allows the nerve flow to get to the organs, water to get to the roses, and the body will heal and regenerate. Healing takes time. If your grass turns brown and then you fix the sprinkler system, it's not green the next day, right? It takes time for it to get back on track. Subluxations distort the structure of the spine, reducing and eliminating curves, therefore altering the biomechanics of the spine. Research shows when this happens, you create a degenerative process that always goes to completion. So you have these curves, and they give your body strength, and when you have these curves in engineering, they give that bridge strength. If that curve is not built right, that bridge is going to collapse. If you don't have the right curves in your spine, then your spine's going to collapse. Subluxation equals degeneration. This is a famous study they did called the Windsor autopsies. They looked at 100 cadavers. They found that everybody had some pinched nerves. Wherever those pinched nerves go, those organs didn't work as well. The worse the pinched nerve, the worse the organ degeneration. So it's important to get adjusted, to remove that nerve interference, allow your body to heal and to regenerate. Why do you go to a chiropractor? To get adjusted, correcting and preventing subluxations. This patient came in at age 52, and they had neck pain, shoulder pain, mid-back pain, low back pain, numbness and tingling down the left arm, depression, migraines, high blood pressure, anxiety, insomnia, tinnitus, and acid reflux. Work had become difficult. They no longer could walk or hike due to pain. Their rate quality of life is 3 out of 10. They're on pain medication and blood pressure medication every day, and they just received their first chiropractic adjustment. So the head's very far forward. They have a reversal of the curve, disc degeneration, bone spurs. So that's going to stretch the spinal cord and the nerves, causing nerve interference. And you can see they have a lot of symptoms. This is a healthy spine, no pain or condition. Patient walks 2 miles pain-free every day. Rates quality of life is 10 out of 10. They're not on any medication. They do take chlorella, which is a compressed algae that has all your vitamins, minerals, and protein in it. They recently received, when they were at age 26, they went through corrective chiropractic care, and they've had a monthly maintenance adjustment every month since then. So you can see their head is half as far forward as the other patient. They have the proper curve in the neck. Spinal cord's relaxed, discs are plump, and no bone spurs. Spinal cord's relaxed, and they have no symptoms. No coincidence. Now, they're 3 years older than the other patient. So patients will commonly say, isn't that just because of my age? It's because of the alignment. It's like, one time I got a new set of tires, and they didn't have the tire aligned properly, and I went on a road trip, and like 300 miles later, I had a flat tire. It didn't have anything to do with the age of the tire, it was the alignment. So wherever you're at, we want to work toward being in a healthier spine. This patient came in with severe migraines. She was on migraine medication, was unable to attend school full time. She was a patient at one of the major hospitals in Jacksonville, seeing all kind of neurologists, MRIs, CAT scans, and the best they could do for her was put her on migraine medication. And so as soon as I saw the x-ray, I could see that her head was very far forward. These two lines are supposed to be parallel, so as her head goes forward, her skull comes back like this, pinching here, where she should have that forward curve. It's completely reversed. So that's going to stretch the spinal cord here. That's what was causing the migraines. So after corrective care for 2 months, the head was back over the shoulders. These two are now parallel. So that allows the spinal cord to be relaxed in here. She gained the curve, the normal curve in the neck. No more migraines. She's off the medication and was able to return to school full time. If she had to come in, she just would have been known as the migraine patient taking this medication, would have had side effects, and just that would have been a miserable life, but we were able to help her. This patient at age 9, we discovered she had a 22-degree scoliosis, and over a course of 3 years, it went from 22 degrees to 16 degrees to 10 degrees. Now, the neat thing I like about this example is the upper neck. You can see how she was way out of alignment in the upper neck, and that's considered one of the causes of scoliosis. And then, so when it went from 22 to 16, the upper neck looked better. Then when it went down to 10, it really looked good up here because the control center was better. This is an older patient, and she went through corrective care in the office. Her curve went from 24/12 to 13/9. This patient got into a car accident when she was about 12 years old, and she came in the office right away. You can see how far her neck was out of alignment. Within 3 days, we saw her leg length and her posture start improving, so we re-x-rayed her, and she had a really nice correction. So when you're younger, it's easier to get a correction. So that's very important, and this really changed her life forever, getting that corrected right away. This patient is also about 12. He had a complete reversal of the curve like this in his lower back, and we see this more and more with gaming and phones and things like that. Within 12 visits, we were able to restore that again, and we taught him how to do those things without hurting his lower back. This patient is the daughter of a medical doctor up in South Carolina. She came down for corrective care and then kept up with her exercises at home, came back for a follow-up. You can see this is 6 months later. She no longer had scoliosis on the follow-up x-ray. And this is a local patient, similar result. Got to the point where he no longer had scoliosis or has a less than 10-degree curve of the spine. And then the process that we use to correct the spine in the office, we call mix, fix, set. Mix is a warming up of the spine to get it more pliable to correct back to normal. Fix is the specific adjustment. And then the set are exercises we do to get the adjustment to hold so that the problem will continue to get better, okay? Scoli brace. So we call it an overcorrective or supercorrective brace. So like we said earlier, normal medical bracing is just kind of squeezing your spine like a tube. With Scoli brace, if your spine's in this position, the brace actually puts you in the opposite position. But it's actually correcting your spine three-dimensionally at the same time, which the traditional braces do not do that. They can actually make your spine worse from the side because we know you should have this thoracic kyphosis, and many of them actually push the thoracic spine forward, which will make the curve worse. So we do a structural scan of the body that creates a hologram, and then we send that to Australia with the posture pictures and x-rays, and the engineer makes the custom brace for you. It Velcros on the front so you can put it on yourself easily. Traditional medical scoliosis braces usually Velcro on the back, so it's harder to put on. You usually need help to put it on. This one you don't. There's air holes for ventilation. You can move in the direction of the correction, but not in the direction that makes it worse. So when you're walking around, you're always correcting the spine. This patient, you can see she had a translation to the left. The brace gets her to go to the right. With the brace off, she's back in the middle. And then 12 months later, she's able to hold the correction. This is without her wearing the brace for a few days. And her curve went from 33 to 11 to 6 degrees over 22 months. This is an adult wearing a brace. So with the brace off, he had a 64-degree curve. And with it on, it goes down to 39 degrees. So the brace can be used to make you feel better. Some reduction of the curve, not as drastic as an adolescent, but it can really help to control the scoliosis, make people feel better as an adult. And as you get older, the scoliosis can degenerate, and the brace can be very helpful in keeping people aligned sagittally. What that means is lined up like this, your nose over your chest, over your hips, and then from the side, your ear over your shoulders, shoulders over your hips. What they found is your chances of being disabled as you get older with the scoliosis, if all those things are lined up, you have much less risk. And the brace in an older patient really helps with that a lot. The adult brace is lower cut, and usually because the degenerative scoliosis in adult is usually in the lower back only. Waiting is dangerous, so we want to do everything we can to avoid surgery. So there's risk with surgery, with infection, things like that. You can also have failure of the hardware. So and when you read the scoliosis surgery research, they say it's not a matter of if the hardware will fail, it's a matter of how, if the person's going to live long enough. If they live long enough, something's going to eventually happen. Screws are going to come out, they're going to get bent. If you get into a car accident or something like that, rods will break. And then there's the dilemma of what are you going to do with this hardware? So then you have to do a revision surgery, which no surgeon is excited about because they don't know what they're going to find when they go in to do these surgeries. And they're very complicated surgery. And the body is actually trying to create that scoliosis even though the rods are in there. So a lot of that metal can get twisted and bent, and screws can break and back out and things like that. So we want to do everything we can to avoid the surgery. How do you get subluxations? Well, overwhelming stress. Does that look like mom at dinner time? Traumas. You know, when you get into a car accident, you have a fax report, right? And you always will have a fax report, and your body's the same way. If in the 1996 Olympics, I don't know, some of you might remember Carrie Scruggs. She fell off the balance beam and landed on her head, and then she was able to continue in the competition, and the announcer says she's okay. But I'm watching it as a chiropractor going, man, her neck is messed up. And if you had a pre and post x-ray of that neck, when she landed on her head, it probably caused some permanent damage. But she just didn't feel it at the time. But she doesn't have a good fax report any longer. And then toxins. Bad food and drugs can actually cause toxicity in the liver and the kidney, and then that can cause the spine to get out of alignment. So think about your spine like a breaker switch in your house. And if you have the dishwasher going, the Vitamix, the hair dryer, you know, and then you plug in one more thing, you know, the power goes out or the breaker flips, right? Think about your spine the same way. It can handle a certain amount of stress, but if you overcome that, then it's going to flip out of alignment. The original subluxation, this is a picture taken from a video of teaching Navy doctors how to deliver babies in a normal setting, right? Do you guys see anything wrong with that picture? Any guesses?
On the neck.
Yeah, they're pulling the head, and that can very easily get things out of alignment in here. And then if things don't go well in the birth, then they might have to use forceps. Again, that can very easily get things out of alignment. And that upper neck alignment, that area between the occiput C1 and C2 can very easily get out of alignment with that birth trauma, and that's where the control center is for your posture. So very common in a scoliosis patient for us to see ligament damage in this area, and it may have been caused from birth trauma. The cause of all disease is your body's inability to regenerate. Balance equals health. When you're in balance physically, chemically, and emotionally, you will be healthy. Fourth attitude, only go to the doctor when you're sick and you better have insurance. Better to go to the doctor when you're healthy and then you won't need insurance. Fifth attitude, it costs money to stay healthy. True, however, it costs a lot more money to be sick. 50% of all bankruptcies are caused by medical bills. Prevention makes more sense. Take care of your incredible body. So the worst case scenario is you're out of work and you have accumulating medical bills, right? So we don't like to use fear as a motivator, but that should motivate people to be healthy, right? So you don't want to end up in that situation. So you want to eat some organic food, exercise, and make sure you're smiling, all right? That's a direct order. In the state of Florida, we have an unusual car insurance. It's called no-fault auto insurance. And it's important that you know how it works because you can get into some bad situations if you don't. First of all, when you get into an accident, you can have some unusual things that you may not relate initially to the accident. And it could be nausea, dizziness, jaw trouble, difficulty concentrating, insomnia, ringing in the ears, lightheadedness. So these can be things caused by the accident, but you're not aware of it. In the state of Florida, you have 14 days to get to a medical doctor to say that you have an emergency medical condition. And if you don't do that, your PIP auto insurance will not pay for your health care. So if you get into an auto accident, make sure you get checked. And then the doctor has to put in their notes that it's an emergency medical condition. And so we have this happen over and over again. Even if they go to the emergency room and it's obvious that they had the injury from the accident, if the doctor doesn't put in the notes that way, it can cause trouble later on. So if you get into an accident, make sure you get checked within 14 days, and they use that terminology. 3 phases of chiropractic care. The first phase is what we call relief treatment. We want you to get feeling better right away. If you're not feeling better, then you're not happy, and we aren't either. The second phase is corrective care. That's where we're working the spine to get to the closest possible alignment toward normal that we can. And then the last phase is preventative care, and that's where you get periodic checkups because you don't know whether you're in alignment or not. Remember, we talked about pain is 10% of the nervous system, 90% is controlling all your bodily functions. So you can be getting out of alignment and not be aware of it. So that's where the monthly checkup is very important. The neck bone brings the head over the shoulders and produces the forward lordotic curve. A lot of people are sleeping like this. So this is a way you sleep with the head touching the bed. The pillow puts that curve in the neck, and it really can make a big difference if you can teach yourself to sleep like that. This is me wearing prism glasses, so I'm looking this way, but I'm seeing this way. So if you're reading in bed, any people that like to read a lot in the room, and if you're reading in bed using a device or watching TV, you can be hurting your neck all the time. So it's a good way to correct that. An ounce of prevention is worth a pound of cure. This little guy had infantile torticollis. So after he was born, his neck was stuck like this because his upper neck was out of alignment. And the doctors wanted to come in here and cut this muscle to balance things out. And the mom decided to bring him into us. Within a few weeks, he was back to normal. You can see him doing the tummy time to put that cervical curve in the neck. The mom's happy. And what did Benjamin Franklin have to say about it? An ounce of prevention is worth a pound of cure. Prevention starts early. This mom's had 6 kids, all born at home, and we've checked them all right after they were born to make sure that there wasn't any injury at the birth process. Science-based nutrition is a special exam we do. It looks at your hair, blood, and urine analysis. It determines if there's any toxicity or vitamin deficiency. And then it gives a specific formula based on what those findings are. So we do vitals, health history, your past history, conditions, any medications you're on. We find out about that. The labs may indicate some specific health problems, and then we review the lab findings. You could have metal toxicity, specific deficiencies, or things not working right, and then there's a specific formula given to you to help those things. And then we retest the labs 2 months later or so to make sure everything's looking better. When you find that we've helped you, if you let other people know, we'd appreciate it. That's how most people find us. And we have a quiz on our website, and if you take the 10-question quiz and make 100%, then you'll get an ice pack. So if you go under community services, we'll find out how good you guys listened today. Any questions at all? All right, thank you very much.
You're gonna pass your quiz. I thought it asked what country was the number one for healthcare.